Bethany, just reinforce that message today, a year and a half later, all of that is gone.
All of those symptoms are gone.
Amazing. Welcome, everybody. It's my great pleasure to talk to you today and interview another person who has conquered pain and chronic pain. Her story is similar to many of you. I want you to put yourself in this situation. And if you are in the situation that Bethany was, she's going to tell you, I want you to be hopeful. I want you to be open-minded. I want you to have faith that something good is about to happen to you. And I think when you listen to Bethany's story, you'll be inspired. You will be excited. And you will be wanting to try some things that are new to you, or maybe they're old to you, and you want to try again. Welcome, Bethany, to this interview. Bethany, she lives in the US and she's 37 years old, a wife, and she's a personal trainer. And so you're going to hear a story from, even personal trainers may be affected by pain and chronic pain. So this happened to her. Why don't you start talking about yourself, telling us what happened in the beginning?
Yes, well, thank you very, very much for taking the time to talk with me. I'm so grateful for social media and that I was able to reach out to you and tell you my story and how you were instrumental in it, and also share this story with other people. So thank you very much for having me and taking the time for me. My story started in May of 2023. I'm a personal trainer, as you said, and I've been doing that now for 11 years. I had just started working at a new gym, worked at a few gyms over the course of my career, and I've also trained clients in my own home. But I had been offered a job at a big new gym in my area, and so I happily took it. All the shiny new machinery was just too much to pass up. So when I started that job, I was the second oldest of all of the personal trainers. It was one gentleman and then myself, and then everybody else was much, much younger, and a very interesting and fun dynamic. But I wanted to hire my own personal trainer for myself. I had never had the opportunity to do that. And through this gym's payment structures, I was given the chance to do that at a very discounted rate since I was also employed there. I thought, what better time? So I signed up for personal training with the one trainer that had more experience than I did. And within my first session with him, he started to put me through a number of exercises right at the beginning of the session that were way beyond the intensity and rep range and set range that I've ever trained out throughout my lifetime. And it started to feel very, very difficult to do the movements within just the first 5 minutes. I expressed that to him, and he said some iteration of, no, you just don't push yourself at home, which, based on what we were doing there, sure, I did not push myself like that at home. That was technically true. But I said, it just doesn't feel right. I don't think we should continue. And unfortunately, I allowed him to convince me to keep going. And of course, we all wish we had time machines to go back to a certain time of our lives to do things differently. And this is definitely that moment for me. And by the end of that workout, which was all focused on my lower body, on my posterior chain, the back of my body, so my hamstrings and my calves, at the end of that 60 minutes, I actually couldn't walk back up to the front of the building. And I expressed that to him. And so I had to be assisted back to the front of the building. And he said, you just need to stretch out. And I also thought that doesn't sound right, but I just trusted him. He had more experience than I did. He'd been doing this for much longer than I had, according to what he said in his resume. So he had me lay down and he manually stretched out my legs, which also hurt. And within, I think, about 3 days, my calves were swollen and bruised to the point where I could not straighten my legs out all the way at the knee. So I was on crutches for a few days, put some ice and heat alternating on it for a few days. Of course, didn't do any physical activity. And by the next week, I was able to walk around again, but knew that I needed to rest because there had obviously been some form of muscle tear. So I took it really easy in terms of my workload for about 6 weeks, and I didn't do any lower body exercises. I just did some rehabbing and physical therapy type things for my calves at home, some very small movements, gentle stretching, things like that. made sure to eat my protein and take my vitamins. And at the 6-week mark, I was considerably better in terms of my mobility, and the swelling and the bruising had all gone away. I felt fine again. I had not returned to exercise just yet in my lower body, but I had returned to my normal workload and taking walks, very slow, steady walks. However, at that 6-week mark, I was standing in my house, texting, and all of a sudden I was struck with such severe pain in both legs. It felt like a nerve that runs down the front of the leg from hip to ankle. It was so extreme and so sudden that it caused me to collapse onto the ground, which was very scary.
Mm-hmm.
So at that point, it lasted for a few minutes and eventually went away. And I thought, well, that's strange. But I kept going about my business. But within a couple of days of that moment initially occurring, the pain became constant all the time. And in that first era of the journey of my pain and my chronic pain, it just felt like that nerve on the front of both legs. However, that was the middle of June of 2023. By the end of June, the second or third week, it was my entire lower body that hurt all the time. And it was so severe that I could not get around without mobility aids. So I had bypassed the crutches and I ended up having to be in a wheelchair because I could not move without pain. So at that point, I went to the doctor and started the process of trying to get diagnosed.
Wow. Oh, what a story. And it's not that different from a lot of my patients that I see in my clinic, but I've never seen in my 32 years of practicing, seeing people with chronic pain. I've never seen that one session of an exercise program. So people can really, they can tear muscles, ligaments, tendons by doing something that they are not prepared to. It doesn't mean that it was wrong to you. It was wrong at that time because your body was not prepared at that time. So one session, wow, what a story. And so during those first 6 weeks, you didn't go back to work. So you were not able, were you able to work in the first few the weeks?
I was able to work a little bit. I just lightened the load a little bit. I took a few clients off of my schedule. I would say I cut my schedule in about half. So I would work maybe 4 or 5 sessions a week versus 10 to 15.
But then after that, in that we would call what, a flare up that you had, like or a restarting of a, and that episode that happened with the pain in their legs going down was kind of different from the original pain, because can you explain the difference between this pain that started in the front of your legs and spread to your body? Was it the same characteristics or was it totally different?
It was completely different. So when I had torn the muscles, the pain was mostly from the knee down and mostly on the back of the body because it was my calf muscles. And it was worsened by straightening or attempting to straighten my leg. Like I said at the beginning, I couldn't straighten my leg because the tear was that significant. But if I were to keep my legs bent and not be on them, I could take the pain level down considerably, and Tylenol or Advils, taking something like that would take the pain down completely, or an ice pack. But when that different type of pain set in at the 6-week mark, it was the whole leg on both sides. And once it was chronic, there was nothing that I could do that would take the pain away. It was constant all of the time. And any movement, no matter what it was, even if I were to just be seated and squeeze my muscles in my legs, it was just excruciating pain.
So it was very different. So it was the whole leg, front and back, from the leg knee down, or from the thigh down?
From the hip down. It
From
was
the
the
hip
whole
down.
leg.
Wow. And constant all the time.
Constant, yeah, especially by the end of June of that year. It was 24 hours a day.
Wow.
And there was no relief from it. There was no getting away from it at all.
Okay, so now I think we are all curious to know what did you do after? Like you had tests, investigations. Did they, you go to doctors? Can you tell us about if you got a diagnosis? Yeah, we are. I think we're all curious to see what happened at that 6 week. And it came sudden. You said that it came very sudden.
Like that. Yeah,
Okay.
it was sudden onset. So by the time I was able to get a doctor's appointment, it was at the end of June 2023. And from June of 2023 through January of 2024, I saw so many specialists, I couldn't name them all for you. Throughout that course of time, excuse me, I had 4 MRIs done, I think about 10 X-rays. I had a nerve induction test, an EMG, I think is what it was called. I went to therapy. I went to physical therapy. So I had a lot of things done, plenty of blood tests. And at first, doctors sent in a referral for me to have an MRI on the lower portion of my legs. I think what they were looking for, if I remember correctly, was if a nerve had been entrapped as the muscles had regrown. So that was their first theory. And when I had that MRI done on my lower legs, it showed that that was not the case and that my muscles had repaired appropriately. So that was good news, but still not a diagnosis, unfortunately. The next thing that they started looking for was the development of something like muscular sclerosis or another thing that can flare up and go away, chronic pain, or maybe fibromyalgia, something that can be sudden onset like that, something in the autoimmune realm. They didn't find any evidence of those things. And so they sent me for more MRIs. So I ended up having 2 on my lower back, one more on the upper portion of my legs. So that was the 4 MRIs. And then they kept taking X-rays of my torso pretty much every time I went to the doctor, it felt like. So when they went throughout those X-rays, they discovered that I had a small tear in one of the discs in my lower back in my L4, L5. One doctor said that it was probably the cause of my pain and scheduled me for a steroid shot in that area of that tear. The steroid shot not only did not make it better, but it actually made my pain more significant. They did tell me that in the first few days it might irritate it some, but after those first few days, the pain was so severe, I just wanted to come out of my skin. It continued to get worse after that. So then I saw another spine specialist because they kept focusing on my back at that point. And that doctor said, actually, it's such a small tear that I wouldn't even call it a herniated disc or a bulging disc. It cannot possibly be the source of your pain, but we're going to send you to physical therapy for it anyways. So I went to physical therapy. I saw 2 physical therapists separately at this time. The first one prescribed me something called nerve glides, which I had not heard of before. And they were very simple movements, laying on my stomach and raising a leg and an arm or my head at the same time, wiggling my foot around, rolling my ankle, things like that. And inexplicably, that made my pain so significantly worse. And by this time, even though I had not previously had back pain or any pain related to anything other than in my lower body, my pain had started to migrate up my body. And so I did have suddenly severe back pain.
Wow.
And the pain had radiated all the way up into my head, all the way down my arms, into my fingers. Sometimes it was shooting pains, it was stabbing pains. It could feel like a deep ache. It could feel like tingling, all of these symptoms that could be so many different diagnoses that it was just scary all the time. I felt afraid all the time of this new symptom and that new symptom. And of course, I would run to Google and see what that could be while waiting on my next doctor's appointment. And there's all these horrors waiting for you to say, oh, you have this symptom, you've got this horrible thing. So once the nerve glides didn't do anything, I was sent to a different physical therapist. And that physical therapist was focusing on helping me treat the tear in my disc by doing some other simple movements. And within the first couple of minutes of that, it hurt me so bad that she told me to stop immediately. She said, we're not doing any more movements. I'm just going to hook you up to a TENS device for the rest of your session. So for 3 sessions with that physical therapist, all I did was a TENS device for almost an hour.
Did it help?
And it did help a little bit. And in fact, I would say it was the first form of relief that I had really gotten from the overall sensations, because up to that point, in terms of over-the-counter pain medicines, ibuprofen helped a little bit, Tylenol helped 0%, and my only other option that I knew about at that time was lidocaine patches. And when your whole body hurts, you know, how do you decide where to put a patch that's this big? So that really wasn't helpful.
Nobody offered you to take opioids?
I was prescribed one pain-based medication, and it was gabapentin. I took gabapentin twice, and both times it knocked me out for 24 hours plus. And I was told, you know, your body will probably adapt to it eventually. And that may have been the case, but because I was still, I wasn't doing personal training anymore at this point. Obviously, I couldn't do it, but I was holding on to a pianist job. And with the gabapentin in my system, I wasn't even able to do that because I wasn't awake ever.
Well, you are, yeah, I forgot to say you are a musician too.
Yes.
You
yes.
play, yeah, you told me before you play piano. Yeah, that's,
yes.
I forgot that.
That was like the one thing that I was still kind of able to do, although it wasn't without pain, unfortunately, sitting and standing and walking to and from the piano, and especially using the pedals at the bottom of the piano hurt so bad. But yeah, I was trying to do that. And so the gabapentin just was not an option for me. It's kind of like NyQuil. You can't sneeze if you're knocked out. And so it takes care of the sneezing, but, you know, not so much the living. So I didn't really have any options at that point. And after 3 sessions with that physical therapist, she said, you need to stop physical therapy. This is not right for you. I'm not going to charge you to sit here plugged up to a TENS device. You can buy one on Amazon. So at that point, I was able to find a doctor by January 2024 who did not look at my back. He said, I've seen the x-rays and the MRIs. It's obviously not your back. Your disc is not pressing on any nerves. It can't be the cause of your pain. So we're going to go in a different direction. And he used a term that I'd never heard before. And he said, you know, sometimes people can experience something, what he called nerve derangement. And because I'd never heard that term before, after that appointment, I went home and plugged that into Google. My next steps with him were he was considering a nerve block in one leg to see if that made a difference. He was going to try and figure out some other things in the meantime. But when I went home and Googled that Google search is what led me to your YouTube channel, and specifically your video about central sensitization and what that umbrella covers and what that can look like and the treatments for it and the approach to it. So if you'd like, I can share with you what I did in response to that video as well.
Yeah, so let's back up a little because you told me so many things already here. Yeah. So just to summarize, that's amazing, your journey. Many MRIs, and as I said, MRIs, I've never seen my whole life a normal MRI. Maybe, I would say maybe if I MRI the spine of a 2-month-old baby, I will see, but the moment that they start moving, so MRIs, abnormalities, it's part of our life. It's part of and MRIs are so sensitive to pick up some small things here and there, but if they don't explain the symptoms, like a MRI, a problem here in this disc should cause a problem in this area of your skin, these muscles. But when you have generalized outside of that boundary, the MRI actually is not helpful. But I have a lot of people that they come and they say, my problems are this in the MRI. I said, no, I'm examining you. I'm putting my hands on you. And that doesn't relate to what I see in the image. So that's a very good point that you had. Yeah, the second point that I tried, basically, you tried Tylenol, ibuprofen, gabapentin, which are medications that we use, and when a person has nociceptive or neuropathic pain responds so well to gabapentin. So if you didn't even notice some benefit, you don't have neuropathic pain. And if you didn't respond to ibuprofen and acetaminophen, you don't have nociceptive pain. So I talk a lot in my channel about the 3 kinds of pain. You don't have nociceptive, you don't have neuropathic, therefore it must be nociplastic. And then that video, the central sensitization video, is basically, it's when the nociplastic pain at full gamut. Like when the person, because you don't develop nociplastic pain like, well, you did develop very quickly, but most people, it takes, a couple of weeks and months and the symptoms start accumulating. But in your case, what's very quick. I'm wondering, Bethany, before we go to what did you do, because clearly you don't have pain anymore, do you?
No, and all of those
Zero.
symptoms are gone.
All symptoms are gone. Can you say that again? So,
Yes.
Bethany, just reinforce that message. Today, a year later, year and a half later, all of that is gone.
All of those symptoms are gone.
Amazing. Amazing. So clearly, would you tell us about do you have any idea at what happened at that 6-week mark? That why because it seems that you diagnose yourself with central sensitization, nociplastic pain. That doctor, I've never heard about, what did you say, derangement of nerves? Yeah, me too. I never heard about that term, but maybe that was an opening door for you to seek something different. So you had a nociceptive pain in the beginning. The first 6 weeks was clearly nociceptive. You had a ruptured muscle. That's clearly an inflammatory, nociceptive pain, and your body healed. In 6 weeks, it healed. And then at 6-week mark, your pain system, the alarm system of your body, decided that you needed to have pain again. Almost like that memory came back and it started spreading all over your body. So that's how nociplastic pain happens. But why at that 6-week mark? What happened? Is there any event that happened at that time?
Yeah, I think there were several things that probably led to that. The first thing is that I had taken that job at the gym, which was a huge step back from a previous job. So I had been working at a bank previously, and because of my role at the bank, and the bank was supposed to be going through a merger and they were understaffed and there was so much going on. It was an incredibly stressful environment. So stressful that while I was working at that bank, there were several times a week where I was coming home and having full-blown panic attacks, dissociating, did not feel present in my body at all. Felt like I was hovering above myself, watching myself live my very stressful life. And so I quit that job. I stepped away from that job at the bank for my mental health. I said, this is not good for me. Clearly, my body is from head to toe is showing the effects of this not being good for me. So my husband and I decided right before we got married, right before we became husband and wife, we decided that the move for me was to step away from that job, go back to the thing that I loved the most, which was personal training, and take this job at this new gym. So I had just built up enough clients at the gym to make up for the paycheck that I was bringing home from the bank when I got injured. And then at the same time, there was another very stressful situation occurring with family dynamics that became a very big situation. And so I think those two things combined, both of those events were very much wrapped up in the same timeline of me tearing the muscles and developing the chronic pain. And I think part of it definitely was my body saying, this is too much. This is just too much. You need to go live in a bubble for a little bit and recover from all these things. And then also, I think the fear of the fact that I had to step away from bringing in that income when I had already taken a pay cut. And though we had decided that we had made that decision together and we were both on the same page there, to take a pay cut and then to take a complete pay cut by not being able to work because of the injury that I'd experienced, I think my body was just terrified. During this time, I read a book, When the Body Says No. I'm not sure if you're familiar with Dr. Gabor-Mate. Yes. And of course, his theory is that if you are experiencing just too much, sometimes people are people pleasers, or they become, parentified in their dynamic with their parents where they are responsible for more than they should be, and so many other dynamics and relationships. Sometimes the body will develop a defense mechanism that, causes you pain, but that pain requires you, forces you to step away from the things that were stressing you out, pushing you beyond your means. And looking back, I really think that that was what was happening for me.
Yeah, thank you for sharing. And that takes a lot of insight. Some people need to go to psychotherapy, a psychologist, a counselor to realize those things. And I'm so happy that you did this and this introspection and realize that that was probably the most likely cause of why you were developing those symptoms. So I think now we're getting to the most exciting part, which is she's going to tell you what she did. And I know people, when I have videos of interviews like this, other people will watch you and they will say, well, I have exactly the same symptoms. I have central sensitization. And they will want to follow exactly your recipe, or they want to know exactly what you did. I did many other videos with other people. And I usually tell people, you are unique. And that's actually the title of my second book. You are unique. So your Bethany's recipe may not apply directly to your case. Each person is unique. Each person brings your own past and your own stressors, your own situations. So you all you need, I think, is a coach, a healthcare professional, a physician, a nurse, a physiotherapist, or even a lay coach that can just guide you on what are the options for you, what are the tools that you can put in your toolbox. So what worked for Bethany may not work for everybody, but we are here to listen how you went from that, bottom pit, like you were very debilitated, very disabled, almost a year and a half ago, 18 months ago, and now you're working, you're happy, you don't have more pain. So tell us what worked for you, Bethany.
Yes, and this is definitely my favorite part too. So like I said, when I came home from that doctor's appointment with Dr. Beard, who used that term nerve derangement, and I found your channel and found that video about central sensitization, you mentioned a ton of different approaches. Lots of things like meditation and mind-body therapies, cognitive behavioral therapy, yoga, gentle stretching, movement, you know, a good diet and anti-inflammatory. I mean, just the whole scope of from head to toe, the full body and mind. So I started to implement everything that I had access to, something that I could do financially speaking and mobility wise. So the first thing that we did, my husband and I, we started to kind of use your understanding that you shared about how the brain has created a bunch of new synapses and neural pathways that are dedicated to detecting pain. And so they're constantly looking for stimuli that could potentially cause pain and thus kind of creating it on their own. And so, with that understanding in mind, one of the very first things that happened was my husband got the idea to gently press on my legs. And I know that that sounds so simple, and it was so simple in theory, but for the last 9 months at that point, I was in so much pain that I couldn't lay a bed sheet over myself at night. Any
Oh,
pressure, sitting, standing was excruciating. There was no position in which I could get comfortable. There was nothing I could do to escape the feeling of constant pain. And so for my husband to touch me was something that hadn't happened in months and months. We couldn't hug, we couldn't embrace. And he said, I'm just going to press on your legs. And because at that point I was already in pain and we knew that it was not going to go away, it was just there all the time. I, in that moment, just kind of resigned myself to allowing it to happen. And I put it that way because up until that point, I had been so hyper focused on not bumping into things or not letting anything touch me or preventing potential stimuli. And so for me to just say, I'm going to just allow you to do this was a big difference and a big deal. So I laid down, he put his hands on me, I closed my eyes, I just took a deep breath, and I just exhaled as he began to press on my legs up and down. And it was very gentle. And while he was doing that, I started to tell myself out loud, and he would say it with me, I am safe. My body is healthy. I am well. I am comfortable. Things that I certainly didn't believe at the time. None of those things felt true at all. But I was just trying the theory, with understanding of what you'd shared in your content, that I was experiencing this nocioplastic pain, and that what I really needed was for my body to believe that it was okay. And I'm a big fan of fake it till you make it. There have been plenty of times in my life where I have not had the confidence or the courage or the certainty to do something, and I have been asked it anyway. And so, as a means to try and not fall flat on my face in front of God and everybody, I have just pretended like I knew what I was doing. And those situations usually work out. It usually went well. And so I think that's really what I was trying to do here, was just tell myself, I am safe, even though I didn't believe that. I am happy and healthy, even though I didn't feel that way. And after he pressed on my legs for, I don't know, 2 minutes at most for both legs, I felt less pain for the first time in 9 months. It felt like a miraculous moment. I kept thinking, am I tricking myself, into thinking that I'm feeling less pain? And kind of the answer is yes, but I was like, I don't even care. Let's do it again. So for the next couple of days, we did that every single day. And by the time I went and saw Dr. Beard 2 weeks after the first time I'd met him, when I met him the first time, I was lying down on the exam bed on a layer of pillows that I had to be assisted into the room with because I couldn't sit up and I couldn't stand. I walked into the appointment. I sat down on the chair without a pillow. It was a complete night and day. And when he walked in the room, he said, "Whoa," it was completely different. And I shared with him what we had done, how simple it had been, but the impact that it had had. And he said, I think that worked for you because you trust your husband and you feel safe with him. You trust that he wouldn't hurt you, that he will take care of you. And so he said, let's hold off on the nerve block. I want you to keep doing what you're doing. And I told him that I'd found your video and that I'd started to follow some of your recommendations. And he said, just keep doing it.
Mm-hmm.
So after that point, I did a bunch of stuff. I started doing regular, daily, sometimes multiple times a day meditation sessions with breathing exercises. You have a video called a Sematic. I can't remember the second word.
Somatic tracking.
Sematic tracking, yes. That is the first video on my meditation playlist here on YouTube because I did it every day for like 3 months, every single day. And I started doing breathing exercises, my favorite of which is the 4-7-8. Breathe in for 4 seconds, hold it for 7, exhale for 8. It is the one that calms me the most. I started to do a little bit of stretching, and I really focused my stretching, which I had not done in 9 months at that point. I really focused my stretching on the hips area, especially the psoas muscle, or psoas, depending on who you ask. Just because I had learned that the psoas muscle is often called the fight or flight muscle, because when you get fight or flight, you get that rush of adrenaline, that muscle helps propel you forward in flight. And so if you have really chronically tight muscles in that area, especially that muscle in particular, sometimes for some of us, and I think I fall into this category, it sends the message from the bottom up, we're stressed, there's something wrong, it's time to go, even when there's not. And so I started trying to focus on keeping those muscles in my lower body, and especially that psoas muscle, looser. And then I also started doing a little bit of exercise. And once I felt loose enough and once I felt safe enough, in addition to introducing some stimuli to the legs on top of the pressing, I started using a dry brush. And then once the dry brush felt better, I started using a very prickly shoe scrubbing brush, which was very prickly. And then once that felt safe, it felt okay to do some exercise. When I got to the exercise, I was very scared. I mean, I was very afraid to do that because there's always this fear of, what if this is not the right theory that I've been following and I trigger a flare up or I take myself back 9 months? But I just told myself I have to find out, I have to do it to know. So when I started trying to do exercise, it was very, very basic, very gentle. Even just something as simple as sitting down in a chair and standing up, sitting down, standing up, things like that at the beginning. So I started by doing a couple of mantras. I am safe in my body. I am well. Everything in me is healed. My legs are healed. Things like that were very specific to me. And then when I wanted to progress the amount of movement that I was doing, I started to use a technique that I think I came up with. I'm not sure if I saw this somewhere, but because I'm a personal trainer, I have a ton of videos of myself exercising from over the years that I would post on Instagram or share with clients. And so with the understanding that I've got all these neural pathways that are looking for, pain sensations, trying to protect me, I thought maybe there's still a neural pathway up there or two that remembers what it's like to move without pain.
I
And
love that. Yeah.
if I can trigger those neural pathways, maybe they'll step up to the front. So
I love this. Yes, I'm going to use that.
yeah, and what I did was I started to pull up those videos of myself exercising from years past when I was feeling great and performing great, and I would watch that on my iPad as big as I could make it. Sometimes I would zoom in on myself and watch myself do all these exercises in a very happy, healthy body while I, in real time, was doing some exercises. And sometimes I would watch those and critique myself and think, oh, okay, my back could been a little bit straighter there, almost like I would with a client, so that I was just focused on that and not focused on what I was doing in real time. And that sort of flashback technique started to rapidly progress my improvement. I mean, it was like night and day, just over a couple of days. And when I got bored of that, because I have ADHD, so I get bored of things very quickly, I started to listen to binaural sounds on YouTube, of which there are probably a million or plus videos. So I started to listen to those to activate, both sides of the brain. And then I also sometimes would watch a very loud, dramatic reality show where everybody's acting crazy and there's no space in the brain to think about anything else when everybody's screaming at each other. So that actually worked really well as well. And so with those techniques, plus the meditation, plus, eating things that I knew would make my body happy, getting some sunlight and doing my breathing techniques and just trying to take my stress levels down and take care of my vagus nerve. Those are the things that allowed me to get back to movement the way that I was able to before. And by the time I was sent to physical therapy again for the third time, at that point, the physical therapy was useful in the sense that I was put in an environment where a person that I don't really know was going to be touching me and pressing on my legs and having me move and manipulate me and all these sorts of, movements and things. And that really was helpful just in the sense of making me feel safe in an environment that I didn't have control of, which I feel like was the final boss for me to get back to how I was before, because I had control of what happened in my home to my body with my techniques that I developed, watching your content. And so making it to that point where I could be touched by someone else and I could be in a room full of people doing squats and step ups and all these things that used my legs in a way that I hadn't been able to for almost a year before was, I think, the marker for me having really healed from that experience.
Wow, what an amazing journey. So just to summarize, your injury happened June 2023
It was
and
May
May
in 2023.
2023, and then it
Mhm.
was until June 2024 that you started feeling better, so almost a year after.
Yes, yeah. And I will say that my pain changed sensations before it completely went away. And I think that that's important because when that moment came, I was a little fearful that something else had come up, because it went from being very sharp shooting pains, like lava running through my nerves is what it felt like, to a heaviness sensation in my legs. So there would be, at this point, this was probably April or May of last year, there would be several consecutive days where I did not have the pain. But then I would use my legs, like we do house sitting jobs sometimes. And one of the families we house sit for has a lot of stairs. And so when I would go up and down the stairs several days at a house sitting job, all of a sudden my legs felt very, very heavy, like filled with lead, like I had run a marathon on an empty stomach and then didn't eat for 3 days. It was a very strange feeling. And I was afraid at first, but ultimately figured out that it was probably just my brain misinterpreting a sensation as it kind of had, for the year before. And so I continued to tell myself, you're safe, you're fine, everything's happy and healthy. And eventually that sensation went away completely as well.
You really a personal trainer. You're a personal trainer of muscles, and now you can call yourself a personal trainer of synapses in the brain. You trained yourself so you can help other people. Amazing. And then after maybe June 2024, did the pain come back, or you never had any pain anymore? Did you have any flare-ups or?
I had a few flare ups. They were very minor, but they were very much tied directly to me talking about my experience.
Yeah.
So once I was able financially to afford therapy, just traditional therapy, which I had wanted the whole time, but it just wasn't working out while I was not able to work. I had to tell her my whole story. And then, of course, once I had recovered and wanted to share with friends and family on social media, I was telling my story again, and people would ask me about it. On the days where I would talk about it out loud, some of those feelings would come back. And it was, 2% out of what I had experienced before. It was not anything close to what it had previously been. And it was mostly tingles, almost like my leg had fallen asleep and was waking back up. But I have not had one of those experiences since probably August of last year.
Wow.
So eventually that went away too.
Yeah. I asked this because in many of the patients that I have, and we are doing this brain retraining, I tell them, I say, I'm discharging you, you don't need me anymore, but the symptoms will come back. And when they come back, it's either because you are telling your story. It's very common because those synapses will wake up and remember, there's memory. Or I will tell them it's during a very stressful event that you will have in your life. Like we can't avoid stress and unfortunate events. But I tell them, I'm preparing you for your life here without me. You don't need me. Use the same tools that you learned to remove desensitization, to desensitize your brain and your body. Use them again. They will work again. Go back to your emotions. Go back, do a inventory. What's happening in my life right now? Why are the symptoms coming back? What is my brain trying to tell me? I need to stop and listen and calm down. And then, of course, people, we are humans. We are going to have some more injuries in our life that could be nociceptive or neuropathic pain. So don't worry, your brain will know the difference and you will know the difference. Because a lot of people with fibromyalgia, they say, I'm so afraid that if I have something serious like an appendicitis or an infection or a disease, people will dismiss me because I have pain all the time and fibromyalgia. I say, well, you will know the difference, and a good doctor will, based on your symptoms, will know that this is a different disease. So you do need to be examined if there is any other acute injury. Bethany, is there anything else you'd like to tell our audience? Maybe if you would like leave a message to someone, let's say, imagine another 37-year-old woman who is bedridden right now, pain all over her body. She used to move her body normally. Maybe she played the piano like you played, or maybe not. What would you tell a person that was in that situation?
I would tell that person to be open to all of the possibilities of healing, because from my background and the way that I was raised, if you were to tell me 5 or 10 years ago that meditation and breathing exercises and trying to think differently and reevaluate my friendships and my schedule and all of those things, yoga would be a part of my daily routine and were an instrumental part of my recovery, I think that version of me would completely dismiss it. I would think that a lot of that sounded very silly and kind of like pseudoscience. As unfortunate as it is to say, but that is the way that I was raised to believe. And I'm so grateful for resources like you who share this information, out on the internet where it is accessible to everyone, and making it so easy to understand, because I would not be where I was today if I didn't have access to that information. And it requires being open to different modalities of recovery. And I would also share that I'm of the belief that a situation like this does not come out of nowhere. I think for me, there were several root causes in my lifetime and my childhood that probably opened me up to developing a chronic pain syndrome. I also grew up in a very fear-based environment. I was taught to fear everything and everyone. I was taught to be afraid to go outside, and to be afraid to go to a friend's house, and to be afraid to turn on the TV or the radio. And so as I started to look back, once I had recovered from the pain here, as I started to look back, I realized that most of my decision making, most of my choices, and even some of my hobbies were based out of fear of missing out, fear of disappointing someone, fear of not making the right choice, whatever that may be. If there even is a right choice, I would convince myself that there was one, and heaven forbid I don't get it right. So when I started to develop pain, that fear-based mentality took hold in every corner of my life. So I would walk into a room and subconsciously look for the safest place to sit or to stand or to lean against, out of fear that I would make my pain worse. And so be open to all different types of healing. Try everything that's accessible to you. Try it with the belief that you will recover, and then do what you can to find your cause, or find something that maybe opened up this pathway so that you can be better on the other end. And there is another end to come out on. You just have to find it.
Brilliant. Thank you so much for sharing that. So for those of you who want to learn more from Bethany, I'll put on the description of this video below, I'll put her Instagram account so you can follow her on Instagram. And Bethany will be, I hope you can help us to answer the comments that people will put on this video here. I guess there will be some people that will ask questions. So Bethany, please feel free to answer those comments whenever you can. So thank you very much for coming here and sharing your story. I like to remind people that we are not here, neither me or Bethany, to tell you what to do. I'm not your physician. We are not your therapist. You do need to have a diagnosis. This video is just to inspire you, to give you more education, to give you hope. And I hope that we achieved that. Please write in the comments, what did you think about this video? What was there any eye-opener for you that you listened today, that you'd like to try? Something that you can share with someone? Maybe you don't have chronic pain, but you know someone, you can share this video with them. And please remember, if there's any emergency during this video, please go to emergency or call an ambulance. Don't stay at home if you feel uneasy or not feeling well. And I hope to see you in the next video. Thank you so much for watching today. And thank you, Bethany, for talking to us today. Goodbye.